All right. Well, thanks for your patience. I suspect a couple more people will be joining us as we get going, but wanted to just get started here. So I'm Kara Walker, the Chief Strategy and Engagement Officer at the Idaho Community Foundation. A quick note, we'll also be recording this session. We'll share that and slides out with everyone who's on the call today. If this is your first time joining us for one of our virtual education series events, welcome. We designed these sessions to provide information that we hope you'll find both useful and relevant. If you were able to join us for our first session, we really focused on COVID-19, how the COVID-19 Response and Recovery Fund was able to provide support to communities, the current state of nonprofits in Idaho, and information about food security. So today, I'm really pleased to be able to invite Nora Carpenter, President and CEO of the United Way of Treasure Valley, to present some information on the newest report out about the ALICE population in Idaho. So, who is ALICE? In addition to being the name of my kitty, ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed. And this actually represents about 40% of Idaho's population. So our work with the COVID-19 Response and Recovery Fund and our earlier grant making for census outreach demonstrates that vulnerable populations across the state are disproportionately impacted by COVID-19 and struggle to make themselves heard and counted. But this pandemic has underscored the importance of building resilient communities that are able to respond to, overcome social, environmental, and economic disruptions, including unanticipated crises like COVID-19, and to do so in a way that promotes equitable outcomes for everyone. As many communities have learned, recovery from crisis is sometimes more challenging than managing through it. So it's our goal that our communities are able to identify areas where we can strengthen systems and organizations for greater resiliency, using lessons that we've learned throughout this crisis. And we also hope to promote equitable recovery by linking community well-being and economic opportunity for everyone. At Idaho Community Foundation, we use information like this ALICE report to help shape what this looks like. So at ICF, our community engagement work is really focused around these 4 areas of impact. Each of these was identified through community conversations held in different places across the state. Probably many of you participated in some of those. We also conducted additional focus groups done in partnership with several organizations. So these are serious challenges that we're facing every community in Idaho before COVID. And as we all know, they've now been really amplified by this pandemic. As Nora talks more about the ALICE report data, please keep these areas of impact in mind while thinking about how vulnerable populations are impacted by each of these. With that, I'm very, very pleased to introduce Nora Carpenter, President and CEO of United Way of Treasure Valley, to talk more about the ALICE report.
Thanks, Kara, and thanks to the Idaho Community Foundation for your sponsorship of this report, this incredibly valuable data set, and for your partnership, not just with United Way, but with all of us in the service community across the state. You are leaders in inspiring philanthropy and ensuring the success of organizations and driving community impact. And we appreciate you and your leadership. So thank you very much. It's an honor to be your partner. So let's just dive right in. I'm not driving the slides today. So who is ALICE? You heard Kara say that ALICE is an acronym, and many of you are familiar with this. This is not our first ALICE report. In fact, this is our 3rd update. ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed. So we might think of the ALICE population in Idaho as folks who are pulling up their bootstraps, folks who are working hard but living paycheck to paycheck, the working poor perhaps. United Way really prefers to think of this population, and it's 40% of the population in Idaho, with respect, dignity, and honor. And giving them a human name helps us have not only a common language to talk about in a unified way the service to this group, but also to show dignity and put a face to the folks that literally are the maintainers in our economy, and certainly now are our essential workers. Alice is absolutely at the heart of this pandemic, the group that we think of as our essential workers, and they are on the front line, but they're struggling. They were struggling pre-pandemic, and we know that they are really struggling now. I'm going to go ahead and ask you to move to the next slide. Thank you very much. So this little time that we're going to share together is going to be a combination of how to use the data for those of you who are seasoned ALICE veterans, how to use it for your grant writing, how to use it to drive strategy. But for those of you that are interested in learning the context of the data, we'll be doing that as well. So for those of you who've been following along, there's some brand new features in this report. It is more customizable than it has ever been before, and I'm probably going to use the term geeking out to data about 100 times as we chat about this. But I want to pause here and talk about why United Way cares about this data. Most of you know that across the state, there are 7 United Ways in the larger communities in our state, serving all the regions of the state, all 44 counties. And together we fight every single day for the health, education, and financial stability of every person in every community. And to do that, to make smart decisions, to understand the context within the separate regions of the state and the state as a whole, we need good data. And we knew that several years ago, everything in our state was based on some wonky number built off the federal poverty line number. And as many of you know, because you are practitioners, the federal poverty number is exactly the same calculation for every household, no matter where that household is. Whether you live in Manhattan or Melba, Idaho, the calculation is just based on the number of noses or bodies that live under the same roof. Does not in any way take into consideration what it costs for that roof, or the food, or the car, or the child care at that street address. So our answer to that, to give us good information here in Idaho, was to commission this ALICE report. And it's our pleasure, along with partners like Idaho Community Foundation, to update it every couple of years. And the latest update, my data geek friends, is more web friendly than it has ever been before. And you can slice and dice it to your heart's content. So let's go ahead and jump forward to the next slide, if we could, please. So this is just a quick screen capture and the address, unitedforalice.org, or from any of the regional United Way websites you'll be able to link, to give you an idea of the variety of drill downs, including some resource mapping, which is brand new, and you are really, really going to love the ability to map existing resources to needs as local as your county level. In some cases census tract, but for sure county. And we'll be adding more resource mapping tools to this over the next several months. So let's meet Alice. Let's go ahead and jump to that next slide. Kara said it, I've said it, across the state, 40% of the citizens who live in our beautiful state are struggling to get by. And the way that breaks down for us in 2020 is about 20% of our folks are working. They are earning $1 more than the federal poverty number for their household under their circumstances at their street address in Idaho, but not enough to meet a basic survival budget. We'll get into that here in a little bit. And then 12% of our state population meets the technical definition of poverty. And if we jump to the next slide, we can see how that actually has changed over time. So the good news is, for Idaho, our poverty line number had been relatively flat for a number of years, but post-recession, once we kind of stabilized and the boom started to take off over the last few years, the number of families living meeting the federal technical federal definition of poverty was starting to decline. This is the first time we'd started to see that number dive down a little bit pre-COVID. Remember, all this data, we stopped data collection like in January, right at the edge of the crisis. But the ALICE population for Idaho has gone up, and it's gone up significantly. So how do we sort of look at those numbers? Well, we can break down this data and know that a couple of percentage points of folks who were living under the technical or meeting the technical definition of poverty actually have moved up. So we have seen a rise in the ALICE population from poverty up. That's good. But we've also seen from stability down. That's not good. And the Alice report gives us more context on why that might be. So let's go ahead and hop to the next slide. This one is actually national data. And again, for my data geek friends, you're going to love this. But it gives you a benchmark of how Alice, at least nationwide, and the same is true for us here in Idaho, the cost of living at the margin has grown faster than the benchmark, the consumer price index, the benchmark that we kind of use nationally to gauge how well our economy is doing. So while our economy has done pretty well, the cost to be Alice, the cost to live in a struggling household has actually grown significantly faster. So let's go ahead and jump to the next slide, which gives us a look at how the index for Alice in Idaho tracks for rural and for urban communities. And you can see that the Alice trend in Idaho has been up, and it doesn't matter whether you live in an urban center here in the state or whether you live in a very rural corner of the state. The trend is growing exactly the same. Let's go ahead and move to the next slide. So this is probably the most obvious headline for all of you on this call. I was loving watching you check in and say a little bit about your organization and where you're from. This is probably the biggest no duh that I can share with you. We know that at least pre-COVID, Idaho was a boom town. The whole state was growing. We bounced back and forth between Nevada, between the fastest growing state in the country. But that didn't apply. That boom isn't happening equally or even with any degree of equity. And a lot of it has to do with the lack of movement in our base wage. We follow the federal minimum wage, as you well know, but even I didn't realize that that number hasn't changed since 2019. Holy moly. And yet, I think any one of us would admit that the cost of living, our cost in our household of gas and medical and food and certainly housing has grown. But that base wage has really challenged us. And very specifically, policies in the border states regarding wages and other things, as you'll find out, but specifically wages, because those policies have changed around us, we are creating the hole in a donut financially for our Alice population, and it's really beginning to impact our border communities, how they react, and ultimately it's really impacting the tax revenue for the state of Idaho. And we'll talk about that here in just a moment. So let's go ahead and go to the next slide, please. So I just said costs are rising, wages are not. Just a couple of little points to put that in context. Food costs have gone up almost 50%. We still consider ourselves an agrarian state in relative terms, and yet our food prices are up almost 50%. Just in Treasure Valley, breaking this down a little bit, more than 80,000 Treasure Valley residents weren't certain where their next meal was going to come from when we did a survey of them just at the end of February. You can imagine how that number has changed now. And more than 12% of kids under 18 in Ada County are food insecure, but nearly half of those don't qualify for assistance. That's Alice. Mom or dad, guardian is working. They are earning money into the household, which prices them away from SNAP, WIC, and other food supports, but the family doesn't earn enough to be able to bring in substantial, healthy food to the household. So let's go ahead and jump forward. So we all know that Idaho is considered a high mountain desert. Well, geography and social services are beginning to commingle here a little bit, and that's probably not the best news I can share with you today. Essentially, the bulk of the state is now federally considered a healthcare desert. And what that means is that there's a lack of providers within a reasonable travel distance of where residents live. And there's only a couple of parts of the state where the balance is pretty close. Ada County is pretty close. You get into the Coeur d'Alene area, really in the metro Coeur d'Alene, pretty close. Idaho Falls, pretty close. Beyond that, we have a huge shortage of primary care, reasonably close to our residents, and that's a problem for Alice. Alice is transportation constrained as well as income constrained. So getting to accessing healthcare that will keep them stable and employed is really a challenge for us now. Food is just an issue all across the state, and it's only been aggravated by the pandemic. But we have a bigger USDA food desert footprint today in 2020 than we did 2 years ago, and it's grown substantially. And yet we have been, but pre-COVID, we've been in boom time. And then 50% of the state is considered a child care desert. I saw lots of our friends from Idaho AEYC, Association for the Education of Young Children. Thank you for being on this today. Thank you for the good work that you're doing. I know that you, as United Way are really concerned about our child care providers. We already had too few. We had definitely too few providing really high quality care for our kiddos across the state. And whether those will survive through the pandemic is really a big question. And that's an economic problem. That's not just a education or stability or mental and behavioral health problem. That's an economic problem. So I feel like Debbie Downer today, but there's good news, I promise. So let's go ahead and jump ahead and start to look at this regionally. So I mentioned at the top of this presentation, and my Alice Passionistas know, that one of the values of this data set is you can get pretty granular. So I just grabbed a handful of states from the top to the bottom alphabetically to give you a sense of how the federal poverty number, FPL, and Alice combine to create the percentage of the awareness around a percentage of the population in at least a county that are struggling to survive. And you can see that where that 40% comes from pretty quickly. Our best scenario is in Jefferson County over on the eastern side of the state, a relatively rural county, relatively small county with a third, only a third. Our highest is Clark County. That flipped positions with Owyhee County in southern Idaho, close to Boise, was previously the highest county. But interestingly, as Alice has shifted in search of housing away from Ada and Canyon County, which is where all the employment is for our area, the majority of employment, we are pushing people out to Owyhee County in search of affordable housing, which drives up a little bit their income, but it's still not where it needs to be, not by a long shot. So if there's a county here that jumps out at you, we are going to take some questions as we go along. You might just kind of put a head scratcher and say, what, really? Is that true? Hopefully you know where these counties are. This is also your geography test, but just to give you a little anchor here, Blaine County is the Sun Valley area, so resort, obviously known as world-class resort. Kootenai is where Coeur d'Alene is, also a world-class resort. And Washington, everybody says, where's Washington County? That's right up against the Oregon border outside of Ontario, just north of Ontario. It's where Weiser is located. So let's jump forward and get a good look at the heart and soul of the Alice report. So everything within this report is based around this kind of a budget. And what you're seeing here is a survival budget in aggregate for the state. So this is Idaho in its entirety. And the Alice budget always includes, for comparison purposes, those basic survival necessities that you see listed on the left-hand side of your screen: housing, childcare, food, transportation, healthcare, technology, read that as a smartphone, miscellaneous, so a little bit of money for things like clothing, taxes, because Alice works, and then what that monthly household total needs to be, or family total, what the annual total would be, and then working it backwards, what an hourly wage would be. Please note, this is a survival budget. This in no way reflects the reality of what it is in the moment to try to find a house, for example, to try to find rent. This is all they have for their household just to survive. And you'll note as you look across that there are more categories now than there have been in previous reports. So there's more family combos, and we've included senior citizen budgets. Defining seniors as the federal government does is over 65. Yay, I'm not there yet. Thank you, AARP, for bombarding me and thinking I am. So housing comes from HUD primarily and some Idaho housing data. So housing presumes that the family is housed. It presumes a rental, does not include any money if the family needs to find a new place to live. So no first and last month's rent. This is just a sustainability. I'm going to come back to an interesting thing that's happening in the housing market, at least here in Treasure Valley. Childcare is very basic childcare. This is not presuming a high quality Idaho Stars qualified center. This is kind of keeping the kids basically intact for a few hours each day. Food comes from the USDA's basic survival food budget. So think high carbs, high processed, cheap. Read that as cheap, not healthy necessarily, just the least costly. Transportation presumes one running vehicle, gas, and insurance, and nothing else. So there's no rainy day fund, there's no new tires, there's no dead battery, there's no fender bender, nothing. It presumes the vehicle runs and that you have a little bit of money for gas to get around and get to your job. Healthcare follows the ACA, so it presumes that this family is acquiring the insurance that's required of it. But in most cases, that insurance is being paid out of pocket. It also sets aside and includes a little bit of money for prescriptions and the occasional doctor's visit, but nothing else. No rainy day fund, no emergencies, nothing like that. Technology, as I said, presumes the most basic smartphone plan and does not include a payment for that phone. It's just the most basic plan to keep it running. Miscellaneous is 10% of everything above the miscellaneous line for things like food and maybe a pet or school supplies, not much. Taxes are always a figure here because Alice works. So Alice is contributing taxes. So then you can see the monthly total, annual total, and hourly wage. So remember, our base wage in Idaho is still $7.25. Most of these folks have to have some multiple sources of income because obviously a minimum wage job is not going to cut it in any way, shape, or form. And even a $10 or $12 an hour job is not sustainable. So let's go ahead and jump to the next slide. Take a look at those two numbers, housing and childcare. So housing is at absolute crisis level in Idaho. That's again another one of those no-duh kinds of statements. And I don't think any of us could find housing where we live easily for that number because it's such a moving target. And childcare now is the same or roughly the same as college tuition. Again, remember, that's not an Idaho Stars qualified program necessarily. That's just basic childcare. Childcare is an economic engine that we have to pay attention to in our state. So thank you again to our Idaho's AEYC folks. So let's go ahead and jump forward and I'll give you a couple quick samples of some county. So I've just chosen a couple of counties for reference so you can kind of see how this game is played. So this is Bonneville County. Over on the eastern side of the state. You'll see the same single adult, two adults with kids, a couple variations, single senior, and two seniors. And again, you see that same housing, childcare, food, etc. So you'll notice, if you recall what the state number looked like, a couple of these have gone up. Childcare for our 2 adults and 2 kids in care has gone up relative to the state number. Transportation has gone up relative to the state number. So Bonneville County, it costs a little bit more than the state average for just a survival budget. So let's go ahead and jump forward and take a look at Ada County plus some fun and games. So again, same format. This is Ada County. You'll notice that the cost to live has gone up pretty dramatically relative to Bonneville County. But you'll also notice a quick snip there at the bottom of your screen. With this report, you now can customize the households to meet your client needs or your service needs or your strategic planning. So if you want to create a budget based on households that are more representative of the folks you work with or serve, you can do that now by adding. You can say, gosh, we have a lot of our families who are living doubled up with seniors now because seniors are losing housing. So we want to add 2 adults, 2 kids, and a senior to the budget and see what that does. You can do that now. This is grant writing gold, my friends, and we are so excited to be able to bring this to you in partnership with Idaho Community Foundation. So I want to talk now about housing. So if we'll jump forward to the next slide here. Wow, we found this slide, found this little cartoon last week. This is from 1894, and it actually refers to a big industrial event that was taking place at the time. But this really is hitting home for us here in Idaho, and it's a shame that something from over 100 years ago is so resonant today. But the concept that rent eats first for Alice is just this enormous financial burden. So I was doing a little digging around, and I was on Craigslist a couple of days ago because I wanted to see what the context of trying to find a new place to live. The eviction moratorium has ended for our families. We are already starting to hear the ripple effect of that. Many of you are directly working with service providers and families trying to keep them stably housed. That's the most effective way, most economical and healthful way to get our folks through this crisis. We don't want people to become unhoused, and it's so burdensome if they are unstably housed. But I discovered something that I did not know. So at least in Treasure Valley, and you might do this experiment in your community, hop on Craigslist or Marketplace or wherever folks are posting available rentals and see what the add-ons are. So for us here in Treasure Valley, for example, most apartments are asking for an application fee of $40 per adult who will live in the home. Alice doesn't have that. First and last month's rent, that's not really new, but Alice doesn't have that. They're asking for a security deposit in addition to first and last month's rent, and a new requirement of at least either 2.5 times or 3 times the rent in monthly income. So if their rent for a 1-bedroom, 1-bath apartment is $1,000, they need to have at least $3,000 in monthly income just to be considered for that apartment. Alice is generally not in that situation. And if Alice has been furloughed or lost their job due to the pandemic, we have a crisis, my friends, and the housing problems have only gotten worse. So let's go ahead and jump forward now to a quick look at Canyon County, so nearby Ada County. Canyon County has been the first catch basin, if you will, of outbound Alice refugees, if I can say that. So folks seeking more affordable housing, but still wanting to stay close to a job center. The housing price, you will notice, has gone up. Childcare has gone up substantially in Canyon County since our previous report. The cost to live has still gone up across the board. But let's jump forward to the next slide, because this is Canyon County's survival budget. We don't want Alice to survive. We want Alice to thrive. So let's jump forward to that stability budget and have a look and see what the difference is. Whoop, go back one. There we go. So this is our stability budget, and you'll notice that it's about twice what a survival budget is. And the difference is savings and adding more stable housing. So it presumes that they've advanced now to perhaps a mortgage, so they're building some assets, which is a good thing. They're able to have more stability in their childcare scenario. They're able to eat a more quality, higher quality, more healthful food plan, that they have more stability and less crisis in their transportation, technology is more stable, et cetera, et cetera. That's where we want folks to go, is stability, not survival. Okay, so now let's jump forward to that next slide. So this is actually a combination of Alice data and federal data, but more specifically, we are pulling this slide from our Treasure Valley Community Needs Assessment, which was also just launched in tandem with our Alice report. So for those of you in the greater Treasure Valley, you can go to our United Way Treasure Valley website and find the full community assessment. But let's talk a little bit about the impact on policy and specifically on wages in our border states and how it is putting a really weird complexity in place for particularly for our near border communities, Lewiston, Clarkston, for example, Fruitland and Weiser and Ontario, etc. This is a real challenge. And actually, although this slide represents information that was true in the middle of June, Washington and Oregon on the 1st of July just raised their base wage, this minimum wage just went up again. So think about Alice. Alice needs to earn, they need to be rewarded as much as possible for the time they are putting in. So what we're seeing is a cluster of activity for housing inside the Idaho border, but working across the border in these states that pay slightly higher wages, or in some cases significantly higher wages. So that state is receiving the benefit of the taxation on wages, but Idaho is taking the brunt of services and life support for the residents when they come back home to Idaho. This is creating really big tension for our border communities, and is not really serving the state of Idaho particularly well. Okay, let's jump forward to a little bit more deep diving, back to my data geek friends here. So there's some fun new ways to look at this data, especially helpful as you are building your strategies, especially helpful if you are writing grants. One of the ways that you can break this data down and try to continue to understand it, and I think this is super helpful in the pandemic, is what percentage of Alice jobs are very likely to be automated. And the acceleration of automation is happening in real time as a result, of course, of the pandemic. So Alice generally works what we call maintainer jobs. So these are the grocery store checkers, truck drivers, they are sanitation folks, they are housekeeping and hospitality, they are childcare workers, they are teachers. These are the folks that maintain our economy. And yet, a significant portion of those jobs are either in the process of being automated or are very likely to be automated in the next few years. And I would argue that the pandemic is maybe even accelerating the prediction of this. The large donut you can see are our Alice workers. What percentage of those are very likely to have their jobs automated? And the smaller donut is for higher paying jobs, which may be more intellectual jobs, so think lawyers, accountants, that kind of thing, but pay a little higher wage. They are less likely to be automated. So Alice is in a very, very tenuous position as they look forward. So job support, job training is going to be more critical now than it's ever been before. Let's go ahead to the next slide. So for those of you who really like to jump in and play around, there's a resource tab within the Alice website now, and you can map resources by county, by census tract, and by geography. This happens to be a quick snippet of where libraries in Idaho are located within census tracts. And if we go to our next slide, we'll see I just pulled up Idaho County right up in the center part of the state, one of my favoriteest places. So you can get a really quick look at that in the largest single county in the state in terms of geography. The resources from at least a library and literacy perspective are all clustered kind of along the highway, basically, where some of the towns are. And so if we have communities or pockets that are in more of the forested areas or smaller communities, they are further from that local resource. Let's go ahead and jump to the next slide. So there's just one more, moving down towards the Utah border a little bit. So this is Twin Falls County, and again, the same thing, really deep county. Lots of geography there, but notice that in this case, this is still libraries. The libraries are all clustered kind of in the same zone. So if you're Alice, you just have one car, getting to that valuable resource like a library that provides literacy, may provide you with internet, may provide you with 3D printing capacity and other learning activities, is probably a ways away from you. So kind of helpful. And in that same vein, if we go to the next slide, we will see that we can map our Idaho counties for internet access relative to our Alice and federal poverty populations. Think about this pandemic and how it has significantly raised the challenge of ensuring that at least kiddos have access to broadband, have internet access so they can participate in their studies. This is a huge issue for us. We know that the governor and others have struggled with broadband in Idaho for a long time, but this particular resource mapping feature allows you to find your county and will tell you what percentage of our Alice and federal poverty population for that county have access, which then tells you what percentage do not have access. So as caring service providers across the state, this can be a really important conversation starter as you think about galvanizing resources to ensure that kiddos have access to good educational resources for online learning through this crisis. Think about telehealth, telemedicine, telebehavioral health, mental health services. We are accelerating, this crisis obviously is accelerating the need for access, quality, stable signal, and this little tool will give us a really good picture on that. So let's talk about what it would mean. Let's go ahead to the next slide. Let's talk about what it would mean for Alice to get a boost. So why do we really want to think hard and strategize in our own organizations about the Alice population? And this funny little mathematical equation does a really powerful job of telling us what the economic, boiling it down to dollars and cents, frankly. What's the economic story for moving Alice from surviving, that survival budget, to the stability budget that you saw in the Canyon County example? And you can see across that top line that right now, Alice contributes about $5 billion to the Idaho economy. These are all Idaho numbers. You can see what that equates to in terms of tax revenue. And then the yellow box, you can see what the community, in terms of community resources, is investing to help support our Alice population. So if we can get Alice to stability, up to that financial stability where they have basic assets, they are relatively able to weather a financial storm or something like a pandemic, you can see what the wage change is. You can see the jump in tax revenue to the state of Idaho. And again, on that yellow, you can see the reduction in the need for service support. So all the way down there at the bottom, $16.6 billion a year is the benefit, financial benefit to the state of Idaho by moving and supporting and advancing our hardworking Idaho citizens from just hanging on to a place of reasonable stability. We're not talking about driving Lamborghinis. We're not talking about having 6 homes. We're talking about being stable where they are in their beautiful Idaho community. Now I'm going to pause here for just a second and share with you a piece of information that's brand spanking new. So over the last 3 or 4 weeks, the Idaho United Way's taking this data, all of which was gathered pre-COVID, with the cooperation of many of you, we reached out through a survey to Alice across the state. And we received about 1,000 responses up and down the state footprint. And we asked a series of questions about how the pandemic was impacting Alice in real time. And there was 2 little numbers that we're still distilling the full report, but there's 2 little numbers that are just eating away at me. The first is that of respondents who are Alice, 1/3 had less than 1 week's survival in their bank account. So less than 1 week of the resources they need to make their household run. Less than half had 2 weeks. Alice is at the margin. Alice is just hanging on. But we are resource rich in our state. We are smart, we are capable, we are able to work together in ways and make decisions in ways that can help Alice survive the pandemic, move from surviving to stability, and I'm pretty certain that we will get there. So let's jump forward to the next slide, because let's talk about what we can do. We are people of action. Every single one of you on this call is on this call because you want to do something. You want to know what you can do and you want to get fired up to do it. And I'm so grateful for every single one of you. So here are some suggestions straight from Alice's voice. This is probably the perfect time to be talking about this, but we talk about it all the time. And that is to think about our plans, our actions, our programs with an equity and ultimately a systems level lens. We can't work in isolation. We can't presume that one size fits all. That just isn't the case, and it definitely isn't the case for Alice. So the more we can flex and get creative in our thinking, combining resources, imagining how we can think in Alice's terms about the services we deliver, the faster Alice will move from survival to stability. Thinking about the idea of social determinants of health, or social influencers of health is another way to think of it. So health doesn't live at just a hospital. Health is food. Health is being safe and stably housed, free from mold, having clean air, clean water, free from abuse. Having safe transportation, that's part of health. So thinking about all the things that go together to make our families stable, that combination of factors, the combination of all of you together, not just one of us doing one singular thing, but all of us magnified together. Co-location, and mobile, mobile, mobile. Alice tells us this time and time and time again. What Alice doesn't have is time and transportation. So the more we think about how we can co-locate, so think about that library slide, that asset slide. If Alice is going to hop in the car and find time to come to a library to take advantage of the resources at that library, maybe to be able to plug into internet so their kids can download homework, be able to search for a job, what else can happen in that place, in that space that honors and benefits and lifts Alice? We can get really creative. So let's go to our next slide on action. So many of you are familiar with the emerging profession of community health workers and community school coordinators. These are locally based navigators whose job it is to help find resources. Figure out who these people are in your community and connect with them. Make yourself and your resources available to them. As we think, as service providers, as we think about the services we provide, remember our work hours may not fit Alice's work hours. We need to be mindful. That's that equity idea that we may have to be a little more flexible, and certainly during a pandemic. Then advocacy, use our voice. If there is something you care deeply about in this space, speak up. I know we have a couple of legislators or legislators to be on this call, so thank you for your public service. But the rest of us, use your voice, talk to our leaders, share the things that matter most, and make sure that Alice is represented in your comments. So, okay, so I would ask you to drop into the chat box. We'll go ahead and jump forward to the next slide, almost our last slide. I would ask you to drop into the chat box if you are already using the Alice report, how you use it. Do you write grants with it? Are you using it to drive strategy? Are you using it as an advocacy tool? So take a minute and tell others how you're using it. And then start to think about how this data can benefit you and your mission going forward. So go ahead and start dropping your goodies into the chat box there. And with that, I'm going to take us to the last slide, please, Kara. And we will open it up for questions. So for those of you who have been itching to say, so where do I get this data? Here you go. There's your websites. Feel free to dive right in. And again, thank you to Idaho Community Foundation and your leadership for being such a good partner in this.
Well, thank you, Nora. That was a spectacular amount of very, very important information. And so thank you for taking that and synthesizing it for our purposes here today, and then letting folks know how they could dig in a little deeper. Before we start sharing how people are going to take action with Alice and for Alice, we did have a question that came up. How does the definition of Alice compare to the definition of low to moderate income, or LMI?
Yeah, it's really similar. The Alice calculation is a standardized budget based on all those factors, Sandy, that you saw in the on that stability budget. LMI doesn't include some of those same things, and it's a federal number, so it does not take into consideration where, it's kind of like federal poverty number. It's a universal number, doesn't take into consideration necessarily the really, really discrete location of where somebody lives. So it can come down to certain levels like state level, but it doesn't necessarily go down to census tract, and the Alice number goes all the way down to census tract.
Great, thank you. So folks, if you have questions, go ahead and type those in the chat box right now. But for those on the phone, I'll just share out a couple of the answers to Nora's questions. So from Suzanne, I'm using it as both an advocacy tool and for writing grants. Rebecca, we're using it to drive strategy and building out career pathways programs and employer partnerships for immigrants and refugees. MLD programs, we've used the Alice report for grant writing many times, plus we work to build partnerships that can help Alice. Maureen, I use the report to deliver 4-H, non-formal educational opportunities to families lacking internet access.
Awesome.
Tammy, at Terry Riley, we use it to supplement our needs assessment and surveying our communities and help develop programs to support our patients. I use this data and information to inform donors whose charitable wishes include the Alice population. So we still have a couple more minutes, so please feel free. This is your chance right now to ask Nora any questions you might have, or feel free to toss out questions if you have some for the Idaho Community Foundation. Also, just wanted to say a quick thank you to some of our other United Way colleagues who are on the call with us today. But Mark and Samantha, I noticed you jumped in and were able to answer a couple of questions, so we appreciate that. All right. Well, not seeing many more questions come in. So hopefully, again, our deepest gratitude to Nora, all of our United Way partners, and all of you on this call with us today. We hope that you found this relevant and useful information. And stay tuned, because we plan on continuing to bring additional new topics coming up in the future in our virtual education series. So again, if you have any questions, feel free to reach out to myself directly, and I can pass them on to Nora or others. And thank you all very much for being on the call. And we'll share the recording and slides out soon. Thank you, Nora.
My pleasure. Have a great day. Stay safe, everybody.